Just because you're sick doesn't mean you're well. It just means you're not sick. Welcome to the Health Optimization Medicine Podcast. This podcast exists because health is not the absence of disease. It is the active creation of resilience, energy, adaptability, and capacity over time. Health is built on first principles: Salutogenesis, how health is generated; Neotenization, how we preserve youthful adaptability; and Holobiontology, how humans thrive as ecosystems, not isolated parts. Here, we focus on metabolomics, mitochondria, metabolism, nervous system regulation, immune balance, sleep, and recovery, because this is the ground everything else stands on. Whether you're thriving, struggling, or somewhere in between, the foundation determines how you adapt, repair, and respond. Strengthen it, and life gets easier. More resilience, faster recover, and greater capacity for stress, illness, and aging. No sick care, no symptom chasing, just first principles conversations about building and optimizing health. Let's get into it, boys.
Yeah. Hey, foundations is a word I keep hearing this year. I'm curious, just since we're now recording this in January, and for whatever reason, the turn of the year is a lot of time where people reset. Do you guys set New Year's resolutions? Anybody got a good one?
Do you have one, Alan?
Use all my flex spend before it runs out.
Excellent. Did you buy anything? Yeah. Okay, so this is sort of like the next follow-on question is, what did you buy with your flex spend account?
It was more like looking back and saying, what could I write myself or my wife a letter of medical necessity for so I can get them reimbursed, maybe?
Okay.
Juicy details. System. Yeah.
I think that probably the best thing was actually the 8 sleep, because, yep, I know Boomer and I share the love for sleeping on ice. It was arguably probably one of the best purchases. And that actually, when we talk about circadian biology, that's one of our foundational pillars in health optimization medicine.
Yeah. I mean,
it's kind of a big deal. Yeah.
And you know what? Maybe we should reach out to the guys and tell them to sponsor the show, but we take no sponsors here so far, other than prescriptions and HOMeHOPe. But okay, Scott, you're not getting away from this question. New Year's resolutions.
Yeah. I mean, I remember I used to make a lot of them back in the day. And I think what I've realized recently is, like, just like life, trying to keep things simple. My biggest one for 2026 is to try to schedule a time when I'm not doing something as opposed to when I'm doing something. It's very easy for me to overschedule my life, as both of you know, and there's only a certain amount of hours in the day. I always like to say, I wish there were 4 hours extra every day to do work, but that wouldn't actually change anything. I still would schedule all of that time. So that's inherently what what I'm kind of built to do. So if I had to say my goal for 2026, if any, is going to be actually have time where I'm not scheduled, or time when I'm not booking something and actually putting in the calendar to not book something. So that's my big goal. I don't know about you, Boom.
Yeah. So I haven't set New Year's resolutions in a long time because, the probability of them failing is greater than the probability of them succeeding. But a couple of things that I kind of do at the turn of the year is, it's kind of like, you remember that Eminem song, Cleaning Out My Closet? It's sort of like an exercise that Marie Kondo would be part of just kind of going through. I'm looking at my closet over here, which I did this past weekend because I didn't get a chance to do it around New Year's time, of just going through not only my supplement cabinet, which is egregiously large, but also clothes and those kind of things. And rather than doing spring cleaning in spring, I just kind of take the time to do it now. And then the one, I guess, objective I have for myself for the year is to slow down, because I don't know, maybe it's just the fact that I'm getting older, but I'm like, maybe I should just slow down a little bit and smell the roses, especially in Chicago winters, which don't exist. So anyway, let's get back to that word foundations, guys. And I think since this is one of the first episodes that we're doing under the new moniker of health optimization medicine, it's good to lay some foundations here, because somebody tuning us for the first time might not have any perspective as to what health optimization medicine is. And I think in order to embrace health optimization medicine, you kind of have to understand 3 perspectives, right? We talk about the differences, or 3 perspective shifts, and those are a shift from pathogenesis to salutogenesis, a shift from organology to holobiontology, and a shift from geriatrization to neotenization. And so let's kind of volley a little bit here, have some fun. Triangles are the first stable structure in nature, so this is going to be a good conversation.
Love
And
pathogenesis. I mean, this is what Alan and I grew up, in our medical school training. Like, you learn about anatomy for like a hot second, and then as soon as possible, they jump you and throw you all hands, all feet, all everything into pathogenesis, right? Which is
okay, so let's define pathogenesis. Pathogenesis is getting sick, or how would you guys define it?
Well, the way I would define it, and Ellen, you can add in this, is pathogenesis like, why do things go wrong, right? And like, what's wrong with the system? Why did that happen? And then from there, finding ways to treat what's wrong. So you learn pathophysiology, pathogenesis. That's like the first class that I can remember wasn't normal physiology. I think we probably took that, but I think it was more in combination with disease physiology, right? Because that's what we spend the majority of time talking about. Is that how you define it, Alan?
Yeah, I agree. I think of it like what causes disease. And for the listeners, we don't often distinguish health from disease. We just think, okay, well, absence of disease is health, right? And in medical school, we're actually in a very similar way, we don't learn to differentiate that. So as Scott said, we learn the basic anatomy, the basic way that things should work. And then we rush to pathophysiology and pathology, where we just study the disease state actually. And then, so we don't really even learn how things become disease. We just learn that there's healthy and then there's disease. And then we're taught, okay, this is the pharmacology that treats said disease. And we just jump right there. And so it's really no surprise that you go to your doctor and you say, I'd like to get checked up for my health. And they go, well, nothing's wrong with you, right? You don't have any disease state. So, there's not really much that your doctor can sort of offer you to how do you stay healthy, or maybe they're going to share something like that they learned, follow the old food pyramid, right?
What we really end up doing, Boomer, is like we end up learning how to treat diseases and treat pathology, but nobody ever teaches you how to optimize or how to keep somebody healthy.
Yeah, so this is like when I just want to interject here for a second, because look, I didn't go to med school for better or for worse, but one of the things that I always like to, when I explain this to people, I like to talk about healthcare as sort of a bit of an oxymoron in some ways. And I'm talking specifically about the industry, because what we're doing is really disease management, which is basically what you guys just outlined, right? There's no even digging into root cause analysis there. It's kind of like algorithmic, how do we solve this current issue in front of us? But then there's kind of that shift, right? And so when we're shifting over in our first perspective shift that we're going into, we're going from pathogenesis, which is, for what I just heard, what you're taught in med school, all the way over to salutogenesis. Let's jump into that now, because I think this is something that if you're a current practitioner in our healthcare air quote system, you might not be familiar with, but it's something that's worth talking about, right? Like, who doesn't want to get younger?
So like, if we're thinking about, right, if we shift the frame and we say, okay, we all studied how diseases created or generated. Salutogenesis shifts it and asks, how is health created? And this was really, I don't remember a single lecture in medical school where we ever even considered that framework or that perspective. And so, it's no surprise that your practitioner may have no idea what even salutogenesis means if you were to ask them. And so when you think about, it's a foreign word, and that's why we're here. We're talking about definitions. Dr. Ted will often emphasize the precision of language here. And so I think, going through these definitions is really, really important. So if we think about now, what is salutogenesis? It's really about creating conditions in the body that support things like wellness, resiliency, and adaptability. So,
and then for me, just to interject, is Dr. Ted's definition of health really stood out to me when I first heard about it way back in 2017 when he was.
You just secretly like algebra, don't you?
I don't. Maybe algebra one, but maybe after that, getting into calculus was not my thing. I remember that was not easy for me. But with a very simple definition, using some algebra, he made it quite easy for me to understand really what we were talking about here, which is just like we said in the beginning of the podcast, just because you're not sick doesn't mean you're well. It just means you're not sick, right? So health we typically think of as the absence of disease, but what Dr. Ted developed was a definition: health equals A plus B plus C, right? So A is the absence of disease. That is true. B is the balance of anabolism and catabolism, which is the anabolism is the building up, if like Boomer was taking his anabolic steroids to get huge, or catabolic, which is, breaking down. Somebody that's older, they have less muscle mass. They're breaking down. They're going to break a hip, like Alan, because he's in his 40s, like me, And so there you go. Not you.
Still hanging on, guys.
Still hanging on there for a little while. So it's a balance between anabolism and catabolism. That's the B. And then the C is according to the life cycle of the organism. Where are you in your life cycle? Are you early? Are you going through puberty? Are you an early adult? Are you an athlete and looking to optimize for a specific sport? Or are you elderly or older and you're looking to maintain muscle mass? And so you have to understand kind of where people are in that spectrum. And then using that definition, that's when we can create the salutogenesis and use that perspective.
Yeah, I think just one thing to kind of bring this real for people, that when you say anabolic and catabolic, it's nice to kind of put tangibles to that for some that are tuning in that are not necessarily familiar with all the anabolic and catabolic processes of the body. And one of the easiest ways I like to look at this is hormones. Like testosterone is anabolic. And I'm not going to give the actual network one here, but an interesting example of a catabolic one is cortisol. It's quite hard as an athlete to put on a lot of muscle if you're constantly stressed out, right? And so, those are two examples of anabolic and catabolic, and there's dozens to talk about throughout the body. But I think that's a great way to kind of sum up salutogenesis. Now, that's the first perspective shift. Let's go on to our second perspective shift here. Geriatrization to neotenization. And I just want to interject here because when I was giving a TED Talk in 2020, and this was pretty much a couple months after I had spent time with Ted in Manila, and I gave the TED Talk partially about, it was mainly about health optimization medicine and holobiontology. Ironically, that day, the woman after me, who just absolutely crushed her TED Talk, gave her entire TED Talk about neotenization. And we were throwing balloons at each other in the middle of this auditorium on a beach in The Hague. But that kind of sets the frame as to neotenization. But geriatrization and gerontology, I guess, has become a very popular word these days. Let's get into geriatrization. How do we look at that?
Well, Dr. Ted likes to quote this one Greek fable, which is, I think it's Greek, where it's like, basically, if you wish for eternal life, you better as hell wish for eternal youth at the same time, or you're going to live a very old and decrepit sort of existence, right? So there's a lot of emphasis now on longevity, which is good, but the challenge is if you live a long time and your morbidities, like basically you have injuries, illness, conditions that make your life miserable, then why, right? So what we're all kind of going for is a lovely term called morbidity compression, which just basically means that you live as long as you can, as healthy as you can, and you die very, very quickly. Once you do get, some of those ailments or whatever, you go fast, right? In your sleep. Everybody wants to die in their sleep. Like that's like just like the movies, right? It doesn't happen very often anymore. Most people end up going to see Alan and then in the ER and then spending the last 6 months of their life in pain and suffering. And the amount of Medicare dollars that we spend in that last 6 months of somebody's life is like 80% of all of their Medicare dollars. Is a huge amount of money. So in essence, what we're talking about here is different, right? And it's talking about neotenization is kind of the opposite, or at least important to have in addition to geriatrization. I don't know how you think about it, Alan and Boomer, but that's kind of my preamble there.
Yeah. So, gerontology's got a lot of popularity. There's a lot of people calling themselves biogerontologists too. And so just kind of looking at I think you outlined it a little beautifully there in terms of if I were to take, a time continuum of life and just have your x-axis be time, your y-axis be quality, let's say, and you want your quality of life as high as possible for as long as possible. And then like one day you just want that to just drop to zero, right? That to me is sort of the difference. Yeah, as fast as possible. And so, when I think about geriatrization as sort of, getting older, and we have this image of the 120-year-old woman in Italy who has been drinking wine and smoking cigarettes her entire life and somehow has lived to 120, but she can't get out of bed or hasn't been able to leave her house in 10, 20 years. That is one version of getting old. And then you have this idea of what you said with morbidity compression, or just the ability to, live as healthy for as long as possible. So that's kind of how I think about it. Neotenization itself, when I think about getting younger, it's about not only adapting behaviors of what it's like to be young, but also part of what Scott talked about earlier in terms of the definition of health, A plus B plus C, the life cycle of the organism part. When we talk about getting younger, we look foundationally in HOMeHOPe at the cell. And we mentioned earlier about bringing people back to the age of 21 to 60, which is evolutionary optimized levels in terms of how evolutionary optimized levels for both nutrients and hormones. And that's really a good place for us to bring people so that at least foundationally your cells are younger. By definition, they're between the ages of 21 to 30 if you optimize for those levels. And so that foundation, and that's the word that I keep hitting at, is what we set the base for that allows for the neotenization to occur elsewhere. And I don't know, Alan, how much time you spend on social media, but occasionally you see like those pictures of like the cute old couples, and it's like, or I picture The Wedding Singer with Adam Sandler and Drew Barrymore, and he's like at the last scene, he gets on the plane and he sings that song. It's like, I want to get old with you. It's like a new romantic way of like looking at love, right? And so I love over time span. And so, this woman who gave this TED talk, at the end, she was giving examples of like how people neotenize or get younger. And she wasn't talking about it at a biochemical level like we do in health optimization medicine. She was talking about it more in the context of like activities and things. And so going back to that social media point, you see like these old couples that like the old guy's sort of in his, wheelchair going down the street. Hopefully you're not in a wheelchair if you're doing this properly, but like he's like grabbing the ass of his wife, and it kind of like at a younger age it would be seen as inappropriate, but at an older age it's kind of cute, right? And so it's like not only adopting the behaviors that you would do when you're younger, perhaps in with your partner, of course, but also making sure that you bring your cells and nutrients and hormones back to 21 to 30 years of age. So anyway, let's kind of wrap it up on neotenization with Mr. Bookatz here. Yeah. Dr. Bookatz.
Dr. Bookatz. Well, you say that and I like look around for my father here, so, I love what you said about, your goal is not, we talk a lot about longevity, right? And that's a really big buzzword, or healthy aging. And this is really fundamentally different, right? We're not saying healthy aging. We're saying, no, we want to ensure that you have the vitality of what it's like to be biologically youthful. So functionally looking at the basic unit that is reflected in all of your organs and your tissues, and ultimately how you function is at the level of the cell. And so it's very different than what we'd say when you go to your doctor. We are looking at the level of perhaps the organ system, which is important, but rarely there's anything you can do to try to bring back that biological age. And I think when we talk about quality of life and health span, this is really what we're referring to.
Absolutely. All right. So we've covered 2 of the 3 perspective shifts. We're going to go to 3. And just because I have the microphone right now, I want to give a little bit of a foray into this. And so I'm going to passport back to 2019. And in early 2019, I did not know anything about health optimization medicine. If anything, like I'd already been 3 years into dissecting my own health issues, and I've kind of gone through the functional medicine world, and I kind of went through and dabbled with a whole bunch of stuff, right? And then I interviewed Dr. Sherr, to give you a little Nelly reference there for those of you that are old enough to know who Nelly is. And he mentioned this word called the Holobiont. And for me, it was like one of those moments. And you ever have like those divine moments where I know some cool kids call this downloads into their operating system, but you have those moments where you're like, holy shit, I get it. And he mentioned this word called the Holobiont. And I think at that point, I was just grabbing towards any word that sounds cool. And then I heard Dr. Ted explain the Holobiont. And I was like, between the two of them, I was like, okay, I get it. And this is ultimately like how, for me, the vector into health optimization medicine was through the Holobiont. And so the last of the 3 perspective shifts is from organology to holobiontology. And, the Holobiont, we're going to let Dr. Bookatz here explain organology a little bit, but the Holobiont is a concept that was originally, there was a German scientist that did it many moons ago, and then it was popularized in the early 90s by a woman named Dr. Lindmark. She recently passed away, but the idea is that your body is not a superorganism or a collection of cells. You're not a superorganism sitting on top of just cells. You're actually a collection of other organisms. And let me just give examples of those to make it real. We're all familiar at this point, at least I hope we're familiar, with the fact that we have bacteria living in our stomach, right? We have billions, if not trillions of those, right? And there's so many different varieties of them. We also have fungus, and that, we know that there's different populations of fungus that exists in somewhat of a healthy balance in our body for some people. We also have viruses. We have, basically the Holobiont is the idea that you are actually a collection of organisms. And to me, this was one of the moments where I was like, holy shit, I get it, because your job then as the health manager, or if you're taking care of yourself and trying to health optimize, it's not to just jack up my dopamine levels and my testosterone levels so that I'm on all the time and then give me something to just knock out at night. Your job is actually to just balance these organisms and to give them the environment that they need to thrive, right? And so your detection then becomes more of a balancing exercise rather than an exercise in overhauling things. And that can you can look at balances of metabolites. You can look at balances of metabolites in both the gut as well as your cells. But that to me was the moment where I was like, damn, mic drop, done. Okay. But we have to go back here and do a little moonwalk and go into organology. So let's go, Dr. Bookatz. The current healthcare system is very structured on organology. And I was having coffee with a friend who's a pretty prominent professor at a school in Washington, D.C. And he laughed when I said organology. He just said that nails it on the head, but it's hilarious. So what is organology?
So you can think of organology. If you look at our medical system, right? We have a medical system of physicians that are specialists, and they specialize in organs. Right. So, for example, we have a gastrointestinal doctor, we have a hepatobiliary doctors, we have a cardiac doctor, we have endocrinologists, right? And they might focus on a particular organ or a subset of organs. And the role is, or maybe a very, very small part of an organ, or the eye, right? You have an ophthalmologist. And so what they do is they study, organology traditionally studies the role of organs and their roles. And in a more, the more, we'll call it evolved version of this would be looking at the body as a collection of these, we'll call them functionally specific units that should, that work together. However, if you ever go to a specialist, they're going to look at you and your issue through the lens of that organ, right?
And that is like, that's really how I kind of grabbed this whole framework. I was like, yes, this is great, because every time you go into the current healthcare system, and again, there's certain reasons why you would want to you want to go see that specialist. But they're viewing the lens through whatever their bias is more towards, okay, this organ is so important, and therefore the complexities of how other organs interact with it don't necessarily occur, right?
Correct.
And so,
and in a disease-based model, that works, right? If your liver is failing, then you want to go to somebody who is a liver specialist who can help you with why your liver is failing at that moment. But in health, we can't really take the perspective of the isolated organ. And so maybe, Scott, you can tell us a little bit about, we back up our view when we talk about the concept of the holobiont here.
Yeah, it's funny. Way back in residency in medical school, there was a funny YouTube video about going to see a specialist, right? If you go to see a cardiologist, you get an echocardiogram and an EKG. If you go to a pulmonologist, you get a chest x-ray and pulmonary function test. If you go to a neurologist, you get an MRI. Like these are just the things that you do when you're thinking about things from an organ specific way. And we get it, right? You can see these things. Like you can open up a cadaver, a body, and you can see a liver, you can see a heart, you can see, you can see a spleen. But what you can't see unless you're looking under a microscope is that all these organs are run by the same basic cell. And that same basic cell, if you optimize at that level, then everything else gets better because it's all networked throughout the whole system. And when Ted was talking about holobiontology to me, just like with you, Boomer, back in the day, it was like, holy crap, this is exactly what's missing in health, because we know that things don't work in silos. We know that the heart functions and it's a part of a cardiovascular system, and the blood vessel walls and the mitochondria that are in the cells. Like there's all these things that are happening that we know about this. We learn about it in medical school, but we don't realize that there's a basic cell that runs everything. And so, and not only that, like at the basic cellular level, you can see what's happening both from the genetic side, the genome and things, and the manifestations of that in the cellular level, but also the environmental exposures and things that are happening outside of the body. And this is in the field called metabolomics. And that's the field of metabolomics that really drives holobiontology, which is understanding how things are working real time at the cell right now, and what has happened, what's happening now, and what has just happened. And by looking at that holobiont level using metabolomics, which I know are big words, but that holoorganism that is you, and looking at a networked level of metabolites or laboratory values to give you the sense of how a cell works, well, that's the change in perspective that we all need. Because if you look at that perspective, if you focus on the cell, then everything else just sort of goes and extends from there, as opposed to trying to hammer it from the outside and not getting to that basic cell in the beginning.
Yeah, the word that I always love Ted using is that we are an ecosystem of ecosystems. And one ecosystem is the basic unit is a cell, but that's not just our cells within our organs. We're also referring to our microbial partners, who I think, as Ted affectionately refers to as a postnatal organ, which I just love that, because if we start to really think about our microbiota, wherever it may be, we historically think of it in terms of our endoluminal or our gut microbiota, but we have it on our skin and our mucous membranes, in every orifice. There's even different regional differences within parts of our tongue, and our the type of bacteria that lives on the front of our tongue versus the back versus on our teeth are all different, and they perform different types of roles. And so moving to a perspective of, these are also part of us. We're made of these human cells, but we're also made of trillions of these other microbes that work very closely to help us co-regulate things like our immunity, our metabolism, our mood, and so much more.
All right, gentlemen, it's been an absolute pleasure, but we have to wrap things up. Okay, today we've discussed three, and I'm holding two, but I mean three different perspective shifts, which are core to all of health optimization, medicine, and practice. We talked about pathogenesis to salutogenesis. We talked about geriatrization to neotenization. We talked about organology to holobiontology. And ultimately, what does that mean in terms of perspective shifts? It means shifting your perspective from disease to health. All right, I'm going to pass it over to the man with the radio voice to close us out.
So don't forget, everybody, this is a new perspective, but it doesn't change the need for the other aspects of health as well, right? We need acute care, even functional medicine. We have great colleagues that do great work for root causes. But what we're really doing here at Health Optimization Medicine, and we're going to be doing in this podcast with you, is bringing on guests, having people on and having conversations internally to talk about this shift in perspective, right? And so the shift in perspective is this. Health Optimization Medicine is the first standard of care for health, not disease. Tons of standards of care for disease, right? You have diabetes, high blood pressure, cancer, et cetera. That's fine. What we're talking about here is the first ever multi-omics standard of care for health. And so we want to welcome you all home. Health Optimization Medicine is we welcome you home. And Health Optimization Practice is we give everyone hope that there is a different perspective that all of us can share and build as clinicians. So thank you so much for listening to the first episode of the Health Optimization Medicine podcast. More to come, more to arrive, and we'll see you all next time.